One of the common requests that families make when they reach out to the children's program is for testing. I think it's important for families to understand that there is a difference between completing an assessment and doing testing. Often families will say, I want my child to be tested, and they think that the process primarily involves giving lots of tests. Let me say that in my experience, there are many psychologists who enjoy giving tests. Often there are tests that can be given by a psychologist that are not going to be given by most other clinicians. So I want to be careful to explain at the children's program how we differentiate not only the difference between assessment and testing, but the different levels of the testing process as we think about how to help best address your child's challenges. So first of all, remember, assessment begins with what we call an initial consultation, an interview where the clinician talks with the parent to gather background information and to get a sense of what might be going on for your son or daughter. That initial consultation, that initial interview, in my opinion, is one of the most important aspects of an assessment. That assessment is going to include a wide range of topics. It's a comprehensive interview, so we're taking a look at the whole child, not just the problems. That initial stage of assessment or information gathering at our clinic involves what we call the Child Development Questionnaire, so you can submit additional information in writing, and sometimes includes gathering report cards, other questionnaires, just to get the background information that we need as part of our assessment. Sometimes that initial level of assessment clarifies what the issues might be for your son or daughter. Further testing may or may not be warranted or helpful. The second level often involves some very targeted testing, where we're doing a modest amount of testing to look at very specific issues. Sometimes all we need to do is that limited academic testing. We don't need to do a whole battery of tests. At our clinic, often that initial level of testing might include some measure of cognitive capacity or academic skill. That level of testing results in a more modest report, where the information is summarized, our basic review of the plan moving forward is presented. Another level of testing, I think I'm on level 3, is more comprehensive. What we have is issues of differential diagnosis, more complex questions to be addressed. Is it attention? Are there memory issues? Are there issues related to stress or trauma? Where we're trying to address more complex questions that involve many potential aspects of your child's strengths or weaknesses in developing a plan moving forward. Please remember, psychologists can give tests and are skilled to do testing that other clinicians, experts in the field do not provide. So often psychologists will want to do a wide battery of questionnaires and testing that isn't always necessary to address the initial level of concerns. So as you work with a clinic or a clinician, please understand the difference between assessment versus testing, and please clarify what levels of testing you're really needing to develop an understanding and a plan moving forward.